Good morning, friends. Today, what I want to talk to you is about radiology branch. You know, radiologists are those who diagnose diseases from the imaging system like X ray, sonography, CT scan, MRI, PET scan, and they are supposed to give a diagnosis before which surgeons or treating physician can treat their patient depending on this diagnosis, and then of course pathologists will confirm this diagnosis. But so many branches of other medical fields, which includes ENT specialists, neurologists, ophthalmologists, tongue and mouth ENT, which includes only cancers of tongue and mouth like buccal carcinoma, and oncosurgeons of various organs depending on where they operate, breast carcinoma. These are the diseases which are so common, and all goes to the common radiologist who may not able to write a proper report because they are flooded with lot of investigations. I give one example. In COVID time, we used to get 50 to 100 CT scans a day, and I used to talk, being a director of the company, to my chief radiologist as why they did not mention coronary artery calcification, which is seen so obvious. Of course, in my patient, when I used to see these reports, so they say that this patient has come for COVID and we are supposed to look for COVID there or not there. If there, what are the stages of the COVID? I agree, COVID is the cause of mortality on those days, but nonetheless, heart attack is the commonest disease, and the cause of death today comprises of cancer and heart attack, or the CVA, cerebrovascular accident, as a commonest thing. And earliest you can find out by CT scan is the calcification score in the coronary artery, which you can see by doing routine chest HRCT chest. So reason is that they did not pay much attention to it because they are exposed to general radiology. From head to toe, they are supposed to report if there is a meningioma in the brain, or it is a glioma in the brain, or it is a tuberculoma of the brain. They are supposed to report from that to the liver mass, hemangiomas of the liver, or what not the type of diseases. My point is very clear that we have a high time to produce a branches in the radiologies called neuroradiology, cardiac radiology, and oncoradiology, like this, because then only then you will get the best report. This is in on behalf of those patients who don't know what to believe in, what people are saying, because now the confidence of the patient in their physicians are going down, and they rely more and more on radiologists for their report. So radiologists have got more and more responsibility. And I think one radiologist who is a general radiologist cannot opine 100% on the reports of the various diseases that they can see. I will request, and I common thing, that is suggestions to IMA or MCI or Indian Medical Association of Radiology and all the branches to make radiologists into these different groups so they can get a proper diagnosis and they can get well paid off. Of course, when you are super specialist, your paid off will go to that level. So radiologists need not to bother that work is going to go down, because today they work at a very cheap rate. They have got so many patients to do every time, so they work in a cheaper rate also. That volume is coming. But do you think that volume is counted in terms of the patients whose father, mother, or brother or sister is having a disease like cancer or heart attack? I think we should be serious enough to diagnose those diseases before it explodes, before it get volcano-like eruption. I have got mantra called diagnose disease before disaster. Rightly said, diagnose disease before disaster, whatever it may be. And that is possible when you have got a branches of a radiology. Thank you, and we will further give in detailed report of this.